The ceremonial procession with the council members of the Sri Lanka Medical Association and the Goa Medical Association will enter shortly. Proceedings, we will now have the traditional lighting of the oil lamp. For this, I would like to call forward the following dignitaries. President, Sri Lanka Medical Association, Dr. Anand Vijay Vikrama. President, Goa Medical Association, Dr. Vimlasri Uluvattage. Chief guest this evening, Dr. Vinyari Ratna. President-elect, SLMA, Dr. Suranta Pereira. President-elect, GMA, Professor M.B. Samaravikrama. Honorary Secretary and Dr. Lalindi De Silva, Honorary Treasurer SLMA, Dr. Manilka Suminathilaka, Honorary Treasurer, Gaul Medical Association, Professor Channa Yathugoda, Most Senior Past President SLMA, Dr. Preeti Vijay Gunawardana, Most Senior Past President, Gaul Medical Association, Professor Ajit Nagawatha, our orator this evening, Professor Jennifer Pereira, Dean, Faculty of Medicine, University of Ruhuna, Senior Professor T.P. Veeraratna, Director, National Hospital, Gaul, Dr. Ranga Sabapatike, Director, German Sri Lanka Friendship Hospital for Women, Dr. K.M. Somaratna, Provisional Director of Health Services, Dr. Nishani Ubesekara, Regional Director of Health Services, Dr. Prasad Ranavira, and a member of Dr. E.M. Vijayarama family. Thank you, ladies and gentlemen, and please be seated. I would now like to call forward the following dignitaries to the head table. President, Sri Lanka Medical Association, Dr. Ananda Vijay Vikrama, President, Gaul Medical Association, Dr. Vimalasiri Uluwathage, Chief guest for this evening, Dr. Vinyari Ratna, orator for the Dr. E.M. Vijayarama oration, Professor Jennifer Pereira, Secretary, Sri Lanka Medical Association, Dr. Lahiru Kodithuwakku, and Honorary Joint Secretaries of the Gaul Medical Association, Dr. Udari Egudage and Dr. Lalindi De Silva. Once again, ladies and gentlemen, let me welcome you to the inauguration ceremony of the foundation sessions of the Sri Lanka Medical Association in collaboration with the Gaul Medical Association for the year 2024. To formally begin this evening's proceedings, I would like to call forward Dr. Vimala Siriluvatthage, President, Call Medical Association, to deliver the welcome address. Prior to the welcome address, I would kindly request all the members of the audience to please rise for the national anthem.
Sri Lanka Mata, Upper Sri Lanka, Namo 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 Mata, Sundara Sri Barini, Surani Ati Sobhamana Lanka.
Ladies and gentlemen, please be seated. I would once again like to call forward Dr. Vimala Siriluvatthage, President, Call Medical Association, to deliver the welcome address.
Thank you. Good evening. The Chief Guest, Dr. Vinya Areratna, President of Sri Lanka Medical Association, Dr. Ananda Vijayavikrama, the orator, Professor Jennifer Pereira, the Dean, Faculty of Medicine, University of Ruhuna, Professor Tilak Weeraratna, past presidents of SLMA and GMA, provincial and regional directors of health services, directors of National Hospital Goal and German Sri Lanka Friendship Hospital for Women, executive council members of SLMA and GMA, distinguished guests, esteemed colleagues, and honored members of both Sri Lanka Medical Association and World Medical Association. It is truly an honor and privilege to stand before you today as we gather here in the historic city of Galle for the first time in the history of SLMA Foundation sessions. I am delighted to extend a warm welcome to each of you on behalf of Galle Medical Association, especially those who have traveled from far away to join us. Galle, with its rich heritage, coastal beauty, and storied history, offers a unique and inspiring setting for our sessions this year. Known for its 16th century fort, a UNESCO World Heritage Site that stands as a testament to our resilience and cultural pride, Galle has been a place where diverse people and ideas converge, harmonize, and evolve. It seems particularly fitting that we hold our sessions here in a city that embodies the spirit of collaboration, endurance, and progress. Allow me to take a few moments to introduce the Galle Medical Association. Established in year 1940, the GMA, the second oldest medical professional organization in Sri Lanka, dedicated to promoting the competence, welfare, and unity of our members. However, our mission has expanded beyond just advancing professional standards. With this year's theme, Envisioning Future, Embracing Competence, Empowering Community, we have sought to broaden our horizons and tackle pressing health and social issues affecting our community. In this endeavor, we prioritize addressing the challenges posed by Sri Lanka's rapidly aging population, recognizing the need to prepare for this democratic shift. We launched a community initiative called Devani Vasantaya. This program focuses on equipping retiring state workers with the tools and knowledge to plan their retirement effectively, covering aspects such as their physical, mental, and social well-being. By empowering individuals at this crucial life stage, we aim to ensure a healthier and more fulfilling future for our senior citizens. Another critical issue we addressed this year was the growing threat of antimicrobial resistance, a silent but severe global health crisis. To combat this, we initiated an awareness campaign aimed at hospital doctors and general practitioners who play a pivotal role in antibiotic stewardships. As part of this campaign, we also launched an education booklet designed to enhance understanding and promote responsible prescribing practices. Additionally, the GMA made a significant contribution to the establishment of dedicated stroke unit at the National Hospital Galle, aiming to provide comprehensive stroke care for our community. In addition to these initiatives, and in keeping with our theme, Embracing Competence, we continued our regular postgraduate teaching programs and educational activities, which have long been a cornerstone of the GMA efforts. This year, we expanded our scope to include medical students for the first time in GMA-initiated teaching programs, further broadening our reach. These activities included workshops, guest lectures, and collaborative projects, all designed with a special focus on our core areas of activities. As you all know, the Sri Lanka Medical Association stands as the premier medical professional organization in our country, serving as an umbrella body that unites and guides all the other professional medical organizations. This pivotal role, fostering intercollegiate alliances, is both commendable and indispensable. It is a role that must not only be sustained but expanded to address the growing complexities of modern healthcare. Most professional medical organizations focus on a specific field of medicine, which is essential for advancing specialized care. However, when it comes to addressing multifaceted and universal health challenges that impact the nation as a whole, the limitations of working within isolated frameworks become apparent. Issues such as increasing threat of antimicrobial resistance, the growing epidemic of non-communicable diseases, the rapid rise in aging population and their specific health concerns demand coordinated, multidisciplinary approach. These challenges are not confined to one specialty or sector. They require collective effort, pooling knowledge, expertise, and resources across the medical spectrum. It is here that the SLMA's leadership in fostering intercollegiate alliance becomes crucial. By bringing diverse professional bodies together under one vision, the SLMA creates platform for shared learning, collaboration, and unified action. In light of the Sri Lanka government's initiative to upgrade our healthcare system with a major overhaul plan over the next 3 years, the SLMA and its intercollegiate alliances have an even greater responsibility. The SLMA can play an all-important advocacy role in this transformative effort, ensuring that the professional medical community contributes its inputs in a uniform, comprehensive, and impactful manner. By coordinating with policymakers and representing the collective expertise of its allied bodies, the SLMA can ensure that the ambitious plan addresses the real needs of the healthcare system while upholding the highest professional standards. In conclusion, I would like to make a heartfelt appeal on behalf of the Gold Medical Association to the Sri Lanka Medical Association. As the premier medical professional organization in the country, the SLMA holds a unique position of leadership and influence. We urge you to consider focusing on 2 critical areas that are essential to future of healthcare in Sri Lanka. First, we appeal to the SLMA to continue its invaluable intercollegiate collaborative work with even greater efficiency. A united and coordinated medical community is vital to achieving meaningful and sustainable outcomes. Second, we urge the SLMA to take a leading role, advocacy role, in collaboration with other medical professional bodies, to engage actively with health policymakers. It is imperative that we as professionals provide our insights in a unified and comprehensive manner. The SLMA's leadership can ensure that the government's futuristic plan for the health sector is geared to meet emerging challenges and capable of taking Sri Lanka's healthcare to the next level of excellence. As we stand on the brink of significant transformation in our healthcare system, let us reaffirm our commitment to working together across specialties, organizations, and disciplines for the betterment of our nation and the well-being of our people. Let this collaboration between the SLMA and GMA set the tone for the future where unity and shared purpose drive progress. Before I conclude, I wish to express my heartfelt gratitude to the President of Sri Lanka Medical Association and esteemed Council for their trust and collaboration with the Gold Medical Association to bringing this significant event to Gold for the first time. I also extend my deepest thanks to the organizing committee comprising dedicated representatives from both the SLMA and the GMA for their tireless efforts in planning and executing this event to the highest of standards. My gratitude further goes to all the resource persons who have generously shared their time, knowledge, and expertise, enriching these sessions with their valuable insights. Finally, all the distinguished members of the SLMA and GMA who have joined us physically and virtually. Your presence and participation underscores the unity and shared purpose that define our profession. Thank you all once again. Thank you.
Thank you, Dr. Luwathage, for those introductory words and for that warm welcome. I would now like to call upon Dr. Ananda Vijayavikrama, President, Sri Lanka Medical Association, to also welcome the gathering.
Good evening, Chief Guest Dr. Vinyari Ratna, President, Goal Medical Association, Dr. Vimarsiri Uluwathage, today's orator, Professor Jennifer Pereira, Dean, Faculty of Medicine, Karapitiya, Senior Professor Tilak Veeratna, past presidents of the GMA and the SLMA, council members of the GMA and the SLMA, Provincial Director of Southern Province, Regional Director of GOAL, and hospital directors, council members of the GMA and the SLMA, and distinguished guests. On behalf of the Sri Lanka Medical Association, I take this opportunity to welcome you all for these foundation sessions. Sri Lanka Medical Association was established in 1887, first as the Ceylon branch of the British Medical Association. Then it went on to become Ceylon Medical Association and later Sri Lanka Medical Association. In addition to having the annual conference and many other events, annually we have been having these foundation sessions, and this year we selected to do this in GOAL in collaboration with the GOAL Medical Association. First, I would like to thank the GOAL Medical Association for accommodating us and helping us in organizing this this important event. This becomes significant in many ways. First, I was born and bred in GOAL, and I have worked in this hospital. I did my internship in this hospital and then worked thereafter, and was attached to the Faculty of Medicine GOAL for 2 years on secondment. And 30 years ago, I was the secretary of the GOAL Medical Association. So in many ways it is significant. However, more than that, I believe in the present circumstances, collaboration among medical professional association is very important, especially in the present context. As we know, we have many medical professional organizations, colleges, and mostly we were involved in our continuous professional development activities, educating our members and postgraduate trainees, and also at times other healthcare workers. However, in the present circumstances, I believe our horizons has to widen because this landscape is changing. We boast of our healthcare indices quite truly, and we can boast because we can be proud of that. We have achieved many milestones in spite of spending quite a low amount of money for those. We have very good infant mortality rate, as we all know, the maternity mortality rate, and so on. However, for the last more than 20 years or so, the maternal mortality rate, for example, has been static. The infant mortality rate has been static. And we don't see much improvement, or if at all, any improvement in the rates. So our achievements have become static now. And in addition, we are facing an outbreak or epidemic of non-communicable diseases. We know the diabetes is growing, obesity is growing, and more young people are having these illnesses. So therefore, I think it is high time that as professional associations, we look back on our role and decide on our role. And in this instance, our collaborations are becoming very important. As Dr. Ulatage pointed out, we started the intercollegiate committee in 2020 during COVID days, mainly to focus on COVID and the problems faced by us due to that. However, now the intercollegiate committee is taking a different role, and a very important role. Few months ago, probably many of you would know that the intercollegiate committee went through the medicine pharmaceutical list purchased by the medical supplies division for hospitals and decided on important drugs or selected important drugs, and thereby we were able to cut down the number of drugs purchased by the medical supplies division from 1,500 or close to 1,500 to around 800. This is very important because we were spending a lot of money on non-essential drugs, whereas essential drugs were not available because of the time spent for purchasing and also the lack of money. So therefore, and that is one instance where we, the intercollegiate committee and the professional associations, played a very important and vital role. And at the moment, we are discussing on other areas where we can further improve our healthcare services. For example, rationalizing prescription, especially at OPD level. At the moment, there's a discussion with the Ministry of Health to restrict the number of drugs prescribed at the outpatient department to 3 drugs. And there are then, with the Ministry of Health, the intercollegiate committee is discussing on conducting clinical audits and implementing clinical governance. The last week, we had the first workshop under the SLMA with the support from the Ministry of Health on adopting clinical governance among our hospitals and the health sector. So these are some of the simple measures which we can take as professional associations to improve the health care services or further improve our health care services. And for these collaborations are very important. So therefore, I believe this collaboration with the Gold Medical Association and the SLMA will further develop into other avenues in addition to having this conference, and thereby we can see the improvement of our healthcare services and also the improvement of our healthcare professionals. I believe today's session and tomorrow's session will be fruitful session and beneficial session for everybody. And once again, I thank the Gold Medical Association and its official for supporting the Sri Lanka Medical Association in organizing this. Thank you.
Thank you, Dr. Vijay Vikrama, for those welcoming words. I would now like to call forward Dr. Vinyare Ratna, immediate past president, Sri Lanka Medical Association, and our chief guest tonight, to the podium to address the gathering.
Good evening. Dr. Ananda Vijay Vikrama, Honorary President of the Sri Lanka Medical Association, Dr. Suranta Perera, President-elect, Secretary of the Sri Lanka Medical Association, Chairman and members of the Board of Trustees, past presidents, council members and members of the Sri Lanka Medical Association, Professor Jennifer Pereira, past President of SLMA and the orator of Dr. E.M. Vijayarama Endowment oration this evening. Dr. Vimalasiri Uduattage, Honorary President of the Gold Medical Association, past presidents, President-elect, council members and members of the GMA. Dean and members of the faculty staff, academic staff of the Gold Medical Faculty, and Provincial Director Health Services and Regional Director Health Services, distinguished invitees, ladies and gentlemen. In June 1985, Dr. David Werner, a world-renowned public health specialist, in his convocation address at the Johns Hopkins School of Public Health, delivered this powerful message to the graduating class and I quote a few sections from his speech. Those of you receiving a degree in public health are faced with an unusual and in some ways paradoxical challenge. For as we all know, in today's world, the biggest obstacles to health for all, at that time we were trying to achieve health for all by the year 2000, are not technical but rather social and political. Widespread hunger and poor health do not result from scarcity of resources or from overpopulation as once thought. Rather, they result from unfair distribution of land, resources, knowledge and power, too much in the hands of too few. Or as Mahatma Gandhi put it, there is enough for everyone's need, but not for everyone's greed. Given the fundamentally political nature of health, what those of you graduating today are going to do with your shining new degrees in public health, if you are looking for is simply a well-paid, respectable job with a certificate from Johns Hopkins in your pocket, you should have no problem. But if you honestly want to help those in greatest need gain the strength and ability to improve their health and their lives in a lasting way, then your future is less certain and depending on which country you go to, perhaps unsafe. You may try to stay out of politics to work within the realm of public health in the narrower, more conventional sense of baby weighing, hygiene, green vegetables, maternal and child health, oral rehydration solution, and so on. But be careful, even with best intentions, you can easily end up doing more harm than good. Health work is never apolitical. Either it is done in ways that help empower people so that they can take greater control over factors that determine their health, or it is done in ways that try to keep people under control, organizationally disabled, overly dependent on a centralized, institutionalized, over-professionalized, yet inadequate service. I unquote. Over the past 5 years, several political developments in Sri Lanka have had significant implications for the health sector. And our president referred to some of the challenges with regard to procurement of medicines and shortages of essential medicines in the country. And if you look at some of the challenges we have faced, the COVID-19 pandemic highlighted the strengths and weaknesses of the healthcare system. While Sri Lanka initially demonstrated effective epidemic control and vaccination strategies, prolonged challenges such as limited resources, workforce burnt out, and inadequate public health infrastructure underscored systemic vulnerabilities. Coordination between government agencies, military involvement, economic pressure significantly influenced healthcare delivery during this period. And also when you look at the economic crisis which followed, Sri Lanka's economic downturn in 2022 severely impacted the health sector. Those of you who are clinicians in the system and also the public health staff know this very well. Foreign debt default, soaring inflation and depleted reserves disrupted the import of essential medicines, medical equipment, supplies and fuel. This left healthcare facilities struggling to maintain basic operations, resulting in preventable deaths and deterioration of health outcomes, especially for the vulnerable populations. There had also been policy and governance challenges. Frequent ministerial restructuring, reversal of implemented policies, and inefficiencies in health administration and wastage hindered the progress towards universal health. Rising non-communicable diseases, the burden of which has also put a lot of pressure in the healthcare delivery system. Economic instability and reduced investments in public health exacerbated gaps in addressing NCDs, including underfunding, preventive care, and addressing gender disparities in health outcomes. Health workforce challenges also, as a result of the economic crisis, led to economic migration of healthcare professionals due to unfavorable working conditions and insufficient support, further weakened the healthcare system. Efforts to retain skilled workers in the health sector and address uneven distribution of medical personnel have been limited, leaving many rural areas underserved. Corruption and mismanagement. Health sector holds a special place in any society. It is the cornerstone of human well-being and foundation upon which equitable development is built. Yet when corruption infiltrates this vital system, it undermines trust, compromises outcomes, and more tragically, costs lives. Unfortunately, in recent years, unprecedented levels of corruption, inefficiencies in procurement, misallocation of resources, negatively impacted public confidence and strained healthcare delivery systems during these critical periods. If we are to build a resilient and equitable healthcare system for Sri Lanka, we must confront corruption head on. This requires commitment of government leaders, the vigilance of civil society, and the unwavering demand for accountability from each one of us who belong to professional medical organizations. Particularly, the citizens need to also demand accountability. These developments underscore the need for systemic reforms focused on improved governance and investments in a resilient health system to ensure equitable and efficient healthcare in Sri Lanka. We have just seen an unprecedented political change in our country. Can we be hopeful that some of these key underlying determinants of health, social, economic, and commercial, be addressed through a better governing polity within a new political culture? Sri Lanka has a proud history of public health achievements, from our universal immunization coverage to our continuing commitment to free healthcare. We are recognized as a model for other developing nations. But as we reflect on these successes, we must also confront the challenges that persist. Behind every health statistic lies a complex interplay of factors that influence health beyond hospitals and clinics. These factors, the social, economic, and political determinants of health, shape the conditions in which people are born, grow, live, work, and age. Addressing them is crucial if we are to achieve equitable health outcomes for all Sri Lankans. These determinants, the social determinants, include education, housing, community relationships, cultural norms, etc., while economic determinants involve income levels, employment opportunities, and access to financial resources, and the political determinants encompass governance, policy decisions, and prioritization of health in our national agenda. GMA President referred to the role of advocacy of SLMA and the professional organizations, professional bodies such as GMA in this sector. These factors do not act in isolation. They influence one another and collectively shape the health outcomes of individuals and communities, often more profoundly than access to medical care itself. In Sri Lanka, these determinants have played a vital role in shaping our public health achievements, but still disparities remain. Today, we have a unique opportunity and space to advance public health by adopting a holistic approach that addresses the determinants in an integrated manner. We need to invest in community education and awareness. We need to try to reduce economic disparities. We need to strengthen political will and governance. We need to focus on equity. Inequity still in health outcomes we can see very clearly between different population groups, geographic groups, as well as between socio-economic strata. Marginalized populations such as estate workers, the elderly, the disabled, and those in rural areas, including conflict-affected districts, require targeted programs to address their unique health challenges. Sri Lanka is well positioned to address these challenges. Digital health platforms can help bridge gaps in access to healthcare in a uniquely Sri Lankan way, building on the extensive health infrastructure we have. By engaging civil society and grassroots organizations, we can ensure that public health interventions are inclusive and sustainable. Global partnerships can also play a role, but they must align with Sri Lanka's needs and priorities, rather than imposing one-size-fits-for-all solutions. In conclusion, ladies and gentlemen, the advancement of public health in Sri Lanka requires us to look beyond conventional healthcare systems. Addressing the social, economic, and political determinants of health is not just a moral imperative, it's a practical necessity. We must recognize that health is not shaped not only in hospitals but in homes, schools, workplaces, and policy chambers. By taking a holistic collaborative approach like what we have taken by always collaborating with regional medical associations, we can ensure that every Sri Lankan, regardless of their background, has the opportunity to live a healthy and fulfilling life. We need to commit ourselves to building a future where health is not just a service, but a fundamental right for all. We now have a charter for patient safety and well-being, which SLMA has promoted, and finally we were able to get consensus from all groups in the health sector, including the the Ayurvedic and other systems of medicine practiced in Sri Lanka. And the Parliamentary Oversight Committee on Health of the 9th Parliament, the Parliament that was dissolved, approved that charter, and we hope that the new government and the new Parliament puts this as a priority and get this act, this charter passed through an act of Parliament. As medical professionals, it is our duty to prioritize the well-being and welfare of all Sri Lankans, especially during difficult and uncertain times. Though COVID was the first pandemic in our lifetime, it may not be the last pandemic. We must take active steps to fulfill this responsibility without delay. In alignment with our shared vision of SLMA, Lanka Dipasa Kichesu Mapamaji, let us work for the good of all Sri Lankans without delay in promoting our nation's overall health, well-being and prosperity. Thank you.
Thank you, Dr. Ariyaratne, for those interesting and thought-provoking observations and for highlighting some pertinent facts as well. We will now move on to the next segment of this evening, which is the presentation of the Sri Lanka Medical Association Research Prizes and Awards for the year 2024. To present these awards, I would like to call upon Dr. Ananda Vijayawikrama, President, Sri Lanka Medical Association, and Dr. Vinya Ariyaratne, immediate past President, Sri Lanka Medical Association. Ladies and gentlemen, the prizes and awards for the 137th Anniversary International Medical Congress of the Sri Lanka Medical Association. The E.M. Vijayarama Award for the Best Paper, Development and Validation of a Cardiovascular Risk Prediction Model for Sri Lankans. Methananda C., Sanjeeva J.M., Venkatarachi T.P., Vijay Surya H.A., Chandrasena M.C., Veerasinghe T.R., Solongarachi M.D., Ranasinghe A.E., Elpitia I., Samadharma R., Kurukula Surya S., Ranavaka U., Padmeswaran A., Kasturi Ratna A., Kato N., Vikramasinghe A.R., Hadella P.S., and De Silva L. S.C. Sanviratna Award for the second place in Best Paper category. Quality of Life of Women Diagnosed with Breast Cancer, a qualitative study in tertiary care hospital in the North Central Province of Sri Lanka. Jayasekara H.A.D. D.S. Hubaiba T.H., Ilafi M.T.A., Imaya K.P.H., Jayapatam J.H.M.Y.M., Jayasekara R.M.D.D., and Pattinike C.S. H.K.T. Fernando Award for the third place in Best Paper, Subculture and Violence, a qualitative study in a Sri Lankan Technical College. Ratnayaka N., Abhay Singha K., Silva J.D., and Guruge G.N.D. Sir Nicholas Artigala Award for the fourth place, joint winners in Best Paper category, Audit and Clinician Satisfaction Survey on the Composite Rapid Tuberculosis Diagnostic Service. Sinanayaka N.P., Herat H.B.B., Rifan A.S., Shantilata R.P., Pallewata N.C., Kada M., Rajpaksha O.B.W., Herat H.M.P., Bandara R.M.M.S., Bologna B.E., Galagedara W.D., Jayasekara H., Karavgoda A., Mahattila W.T.A., Jayalatara H.R., Sanviratna S.N.P., Pereira G.M.M., Jayaratna TDSS, Dasanayak DMMU, Mahendra Ratna BMCM, Dilshan AS, Kanchu AMA, Pereira J. Wilson Pearis Award for the 4th place, joint winners in the Best Paper category. Age stratified dengue virus, seroprevalence in urban and semi-urban areas and relative infection rates. Pereira L, Jivandara KC, Panila PMB, Gomes L, Karunananda MV, Barry FF, R. Ramu ST, Dhanasekara S, Og GS, Gatsauri NM. Daphne Artigal Award for the Best Paper in Cancer. Comparison of pathological features between young and older women with breast carcinoma at a tertiary care center in Sri Lanka. Gamlaksha D.S., Vijay Singha H.D., De Silva S., Jayavikrama M.M.A., De Silva M.C.V. Sir Frank Gunasekara Award for the Best Paper in Community Medicine or TB. Prevalence patterns, expenditures and associated factors of current alcohol use among male security personnel from the Sri Lanka Army. Jayasingha LV, Semage SN, Prathapan S. Kumaradasa Rajasuriya Award for the Best Paper in Tropical Medicine, Evolution of Antibody Responses to SARS-CoV-2, its variants and other Sibico-virus over time in Colombo, Sri Lanka. Barry FF, Karunananda MV, Jivandara KC, Dhanasekara S, Lasanthi N, Gunaratna A, Rizan FRM, Pereira L, Nimsha T, Tan T, Townsend A, Og GS, Malavige GN. Special prize in cardiology for the best paper in cardiology. Development and validation of a cardiovascular risk prediction model for Sri Lankans. Methananda C, Sanjeeva JM, Ventatarachi TP, Vijay Surya HA, Chandrasena MC, Virasingha TR, Solongarachige MB, Ranasingha AE, Alpitya L, Samadha Peruma R, Kurukula Surya S, Ranavaka U, Padmeswaran A, Kasturi Ratna A, Kato N, Vikramasingha AR, Haddala PS, De Silva HJ. S. Ramachandran Award for the Best Scientific Communication in Nephrology, Detection of Toxoplasmosis in End-Stage Renal Patients and Renal Transplant Recipients using PCR and nested PCR tests targeting B1 gene, the first study in Sri Lanka. Veerasurya GPC, Manamperi A, Manneheka BMHA. Award for the Best Presentation in Pharmacology. Efficacy and safety of deferoxamine and deferoxyrox and deferoperone triple iron chelator combination therapy for transfusion-dependent beta thalassemia with very high iron overload, a randomized controlled clinical trial. Premavardhana A, Vanasingha S, Pereira C, Vijayatilaka MN, Rajakarana RHMG, Samarasingha RANKK, William S. and Methananda S. And finally, the SLMA Prize for the Best Poster Presentation, Access Delays to Essential Surgical Care among post-operative patients in selected hospitals in Colombo District. Vijay Singha HWMJC, Tisera HAKN, Ratnasiri MRK, Hansani WHS, Rishikesh T, Vijay Singha K, Prathapan S. Thank you, Dr. Vijay Vikrama and Dr. Arya Ratna, and congratulations to all our winners this evening. We now move on to a very special segment, which is the felicitation of the Sri Lanka Doctors Cricket. The Doctors Cricket Club has been involved in cricket among doctors for the last 2 decades. The contribution to cricket and exercise has been immense. In a calendar year, over 100 doctors in various age categories are involved in cricket matches. The participation of the doctors has grown over the past few years, representing every corner of the island, and this has indeed been a great achievement for the club. The Doctors Cricket League, which involves Kandy, Colombo, Jaffna, Galle and Dambulla, is a cricket fiesta where the doctors' cricket fraternity meet and engage in a tournament, and is a classic example of the involvement of doctors island-wide. The Law Medical Encounter and Archimedical Encounter are 2 annual events of the Doctors Cricket Club where we have played over many years for the glory, and doctors are the defending championships of both encounters. The other notable tournament is the Professionals Cricket League, where 8 other professional bodies, doctors, lawyers, aviators, marketers, engineers, architects, town planners, surveyors play annually for glory, friendship and camaraderie. Doctors have won the PCL trophy 3 times out of 8 years of PCL history. We would also like to commend and extend our gratitude to Dr. Padma Gunaratna, Professor Chaturanga Ranasinghe and Dr. Rajiv Nirmala Singha, who have uplifted sports and exercise through the Sri Lanka Medical Association Expert Committee on Sports and Exercise. I would now like to call forward Dr. Ananda Vijay Vikrama, President, Sri Lanka Medical Association, Dr. Lahiri Kodituakku, Honorary Secretary, Dr. Padma Gunaratna, and Professor Chaturanga Ranasinghe to felicitate the cricketers. I would now like to call forward representatives from each team of the Doctors Cricket teams to please come forward and receive the tokens. Thank you all. Ladies and gentlemen, with that, we have reached the end of this segment of this evening, and therefore I would like to invite Dr. Lahiri Kodituakku, Secretary, Sri Lanka Medical Association, to propose the vote of thanks.
President and the Council of Sri Lanka Medical Association, President and the Council of Galle Medical Association, distinguished guests. It is indeed a great honor to propose the vote of thanks on behalf of the Sri Lanka Medical Association. This eminent gathering has been more than just a meeting of professionals, but a testament to our shared vision to uplift the standards of medical care and strive energetically towards excellence in every aspect of medicine. It has been a celebration of strengthening time-tested partnerships and forging new collaborations within the medical fraternity. We are deeply grateful to the President, Dr. Vimalasipi Uluwattage, and the Council of the Galle Medical Association for their unwavering support and steadfast commitment towards making this event a success. Our sincere thanks also conveyed to the organizing committees of the Sri Lanka Medical Association and the Galle Medical Association, who have shouldered much of the efforts towards making this event a great success. A special thanks to the Dean of the Faculty of Medicine, University of Ruhuna, for his valued guidance and facilitation. We would also like to acknowledge the efforts of the staff of the Faculty of Medicine, University of Ruhuna, for their support throughout. A special thanks are due to our esteemed chief guest, Dr. Vinya Ariratna, immediate past president of the Sri Lanka Medical Association, and our orator, Emeritus Professor Jennifer Pereira, for gracing this occasion. We are grateful to all the officials of the Ministry of Health, University of Ruhuna, professional colleges, sponsors, and other dignitaries for their presence. Our heartfelt appreciation goes to the staff of the Sri Lanka Medical Association, Nadisha, Nirmala, Nadira, Jayarani, Samaratna, and all other staff members, Raja. Thank you very much for your continued support towards making this event a success. Last but not least, we would like to extend sincere gratitude to Dr. Ananda Vijayavikrama and our President and the Council of the Sri Lanka Medical Association for their visionary leadership and support. If I have missed anyone by name, please be kind enough to note that it is totally unintentional and that your contributions are deeply recognized and truly valued. We are profoundly grateful to each and every one of you. As we close this chapter, let us recall the words of the father of medicine, Hippocrates. Declare the past, diagnose the present, and foretell the future. Thank you, and may we continue to strive steadfastly to build a healthy and a just future for all the citizens of our beautiful motherland. Thank you very much.
Thank you, Dr. Kodituakku. I would now like to invite the dignitaries at the head table to proceed to the rows in front as we will now commence the oration. Ladies and gentlemen, we will now have the prestigious Dr. E.M. Vijayarama Endowment Oration. In order to read the citation of the orator, Professor Jennifer Pereira, and to present her with the orator's medal, I would like to call upon Dr. Ananda Vijayavikrama, President, Sri Lanka Medical Association.
It's a great pleasure and an honor to introduce one of my teachers, Professor Jennifer Pereira, today's E.M. Vijayarama orator. Aurelia Jennifer Pereira ni Karunanayaka, Professor Emeritus, is no stranger to the medical and academic world. Her career spanning over 4 decades has been spent in teaching and guiding medical students at the Faculty of Medicine, University of Colombo, and later Waimbwa University. In 1974, Professor Pereira entered the Faculty of Medicine, University of Colombo for her undergraduate studies in medicine and successfully completed her MBBS degree in 1979 with second-class honors. Following completion of her internship, she joined the Department of Microbiology of the Faculty of Medicine, University of Colombo as a lecturer in 1980. Her postgraduate studies were in the field of microbiology, and she obtained the degree of MD in microbiology from the University of Colombo in 1984 and was certified as a consultant microbiologist by the PGIM University of Colombo in 1986. She was promoted to professor in 2001 and held the post of Dean of the Faculty of Medicine, Colombo from 2015 to 2020. She has supervised many postgraduate students reading for research degrees and guided them to successful completion of their master's and doctoral degrees in universities of Sri Lanka. She has been an examiner in medical microbiology for medical undergraduates at the Faculty of Medicine, Colombo, postgraduate students at the PGIM, and postgraduate research theses for universities in Sri Lanka. She was the chairperson of the Board of Study in Microbiology from 2009 to 2014. She has been the warden of Women's Hostel as well as Students' Counselor of the Faculty of Medicine for many years. She was the president of the Faculty of Medicine Teachers Association in 2011, Section A of the Sri Lanka Association of the Advancement of the Science in 2000, the Sri Lanka College of Microbiologists in 2002, the Vaccine Forum of Sri Lanka in 2010, and Sri Lanka Medical Association in 2015. She has been invited to deliver many lectures and orations and keynote addresses. She has contributed at many consultative meetings on infectious diseases, immunization, and gender-based issues. She has been a member of the National Research Council and is the current chairperson of the Working Committee on Biotechnology and the chair of the Research Committee of the National Science Foundation. She is the co-chair of the Board of Directors of the Center for Women's Research, a non-governmental organization. She has received many academic distinctions, scholarships, awards, and prizes for research and has an H-index 30 with 4,820 citations. Her interests have not been limited to microbiology. Her ability to learn is continuous and aptly demonstrated by the successful completion of a postgraduate diploma in gender studies from the University of Colombo, which she achieved with distinction in 2002, and thereafter the postgraduate diploma in medical education from University of Dundee, UK in 2010, as well as a master's in business administration from the University of Wales in 2013, winning the gold medal. Madam, it's a great pleasure and honor to invite you to deliver this prestigious oration, E.M. Vijayaram oration today.
Dr. Vinyarirathna, chief guest tonight, Dr. Ananda Vijayavikrama and Dr. Vimalasiri Uluwathage, presidents of the Sri Lanka Medical Association and Gaul Medical Association respectively, past presidents, presidents-elect, council members, members of the Sri Lanka and Gaul Medical Associations, Dr. Tilak Veeraratna, the Dean of the Faculty of Medicine, the Provincial Director and Regional Director of Health Services from Gaul, and members of the E.M. Vijayarama family, and distinguished invitees, ladies and gentlemen. First and foremost, I thank the SLMA for inviting me to deliver the E.M. Vijayarama Endowment Oration for 2024. I am honored and humbled by this privilege. First and foremost, I thank the President for the kind words of introduction. Although we have heard much about late Dr. E.M. Vijayarama, it is customary to speak on the life and contributions of Dr. Vijayarama at this oration held to honor the memory of this great man. Dr. Edmund Medonza Vijayarama was born on 6th August 1896. He hailed from the southern city of Koskoda and received his education at the Rajapaksa College and later at the Royal College, Colombo. He entered the Ceylon Medical College in 1916 and qualified with licentiate to practice medicine and surgery in 1922. He completed his internship at the Colombo General Hospital and served as District Medical Assistant Abisavela for a short duration before returning to the Colombo General Hospital as a medical registrar. Subsequently, he proceeded to complete his postgraduate training at the University College Hospital, London. Upon completion of postgraduate training, he returned to Ceylon and was placed in charge of teaching students and preclinical subjects as well as clinical teaching. He served as the pathologist General Hospital, Colombo for a brief period in 1935, and armed with both MD and MRCP, he was appointed consulting physician, General Hospital, Colombo, a post he held till his retirement in 1956. He took an intense interest in medico-social activities in the country and actively participated and steered the affairs of the Ceylon branch of the then British Medical Association and served as its president in 1947. The Sri Lanka Medical Association lived a nomadic life for almost 8 years till Dr. Vijayarama and his wife graciously gifted their magnificent residence to the association in 1964. His magnanimous gesture was appreciated by naming the McCarthy Road on which the house is located as the Vijayarama Mawatha during his lifetime. The Vijayarama House at number 6 Vijayarama Mawatha, Colombo 7 continues to be the house for the SLMA office and the Ceylon Medical Library, now the Sri Lanka Medical Library. He was also an active member of the Government Medical Officers Association, which was in its formative years at the time and later became its president. He was a member of the Ceylon Medical Council and later its president, contributing immensely to advancement of medical ethics and etiquette among the physicians. He was a physician of outstanding caliber who took much interest in medical education, both undergraduate and postgraduate. He was a member of the University Court for several years and was conferred the Doctorate of Science by the University of Jaffna in recognition of his service to medical education in the country. The inception of the Ceylon College of Physicians was the first brave step to foster postgraduate training in Sri Lanka, and Dr. Vijayarama was elected its founder president, a post he held for a period of 3 years. During his presidency, arrangements were made with the Royal College of Physicians of London, Edinburgh and Glasgow to hold the Part 1 of the MRCP UK in Sri Lanka. This was the first time this examination was held beyond the borders of the United Kingdom. Dr. Vijayarama was the first to be elected a Fellow of the Ceylon College of Physicians and was also bestowed the Fellowship of the Royal College of Physicians in his later years. He was a man who practiced what he preached, a medical educationist who fashioned the future generations of the profession. He was a humanitarian whose acts of benevolence extended beyond the boundaries of professional, religious, or racial confinements. He passed away in December 1980 at the age of 84, leaving behind a legacy that still lives on and influences the lives of all those who pass through the doors of the Vijayarama House. It is pertinent that I pay tribute to this great personality who worked towards the betterment of mankind by choosing a topic that directly impacts the lives of patients and specifically those living in Sri Lanka. I got interested in traditional medicine when I had to serve on the board of directors of the Institute of Indigenous Medicine from 2015 to 2020 as an ex officio member for near 6 years while I was the Dean of the Faculty of Medicine, Colombo. And I actively participated in their numerous activities. Also, immediately after my retirement from the Faculty of Medicine in early 2021, I received an invitation to work as a clinical trials consultant for the Research and Development Center of Linked Natural Products, an organization which has been in operation for 45 years on production of traditional medicines. With these two experiences, I was able to comprehend the merits and demerits and advantages and limitations of traditional medicine at close quarters. I believe that traditional medicine, which is an invaluable local heritage, could play a substantial role in fulfilling health requirements of our population if it is managed and operationalized in a more productive and a collaborative manner. Therefore, the topic I chose for the E.M. Vijayarama Endowment Oration is titled Bridging Allopathic and Traditional Medicine for Enhanced Patients' Outcomes. As this audience is relatively new to this topic, I will start from basics of traditional medicine and move down to justify the argument of my topic. My oration will first define what traditional medicine is, and we'll talk about methods used in traditional medicine, about the predominant traditional medicine systems in the world, and compare traditional medicine and modern medicine, and the traditional medicine systems practiced in Sri Lanka and resources available in this country, prevalence of use of traditional medicine and spectrum of diseases both in Sri Lanka and also globally, and current models of integration and their benefits, and the WHO stand on traditional medicine and the challenges for integration and the proposed way forward. So what is traditional medicine? Traditional medicine is also known as complementary medicine, alternative medicine, and these terms are used interchangeably with the term traditional medicine. Traditional medicine encompasses the knowledge, skills, and practices developed by various cultures over many generations. They are used to maintain health, prevent and diagnose diseases, and treat both physical and mental illnesses. This approach to medicine has been passed down over centuries based on folk wisdom, experiences and observations, and cultural beliefs. Allopathic medicine, which most of us are familiar with, is also called Western medicine, biomedicine, conventional medicine, mainstream medicine, modern medicine, and orthodox medicine. It is a system in which medical doctors and other healthcare professionals, such as nurses, pharmacists, and other allied health staff, diagnose and treat symptoms using investigations, medicines, and surgery, and various other interventions. Now, the types and techniques of traditional medicine vary. Generally, allopathic medicine is practiced or governed by more or less a uniform set of guidelines which are practiced across the globe. In contrast, traditional medicine, although practiced globally, has diverse approaches and techniques. These are significantly different depending on cultural and regional differences geographically. But certain components and approaches are common to all traditional medicine, and I will address a few of these features in traditional medicine. All systems of traditional medicine use a holistic approach. They view health as a balance between physical, mental, and spiritual well-being. Practitioners consider not only the symptoms, but also the patient's lifestyle, emotional status, and the environment. The treatment received by different patients for the same illness is different, and therefore it amounts to the practice of personalized medicine, which has become a buzzword in allopathic medicine more recently. The other important feature is that the remedies used in traditional medicine are natural products. The medicinal plants take the center place in many traditional systems, but heavy metals like lead, mercury, copper, gold, iron, silver, tin, these heavy metals, and they are used in some systems of traditional medicine. Animal substances such as blood, meat, hair, skin, tail, bones, teeth, fat, glands, and even fecal pellets are used predominantly in Unani-based medicines. Many traditional practices incorporate mind-body techniques to promote wellness. Techniques like meditation, breathing exercises, and movement-based practices such as yoga and Tai Chi are integral to traditional systems. Traditional systems, medicine systems, often include techniques like massage, acupuncture, chiropractic adjustments. These therapies aim to restore the body's natural balance and relieve pain or discomfort. Leeching, cupping, and moxibustion targets the vascular system through skin in certain systems. In some traditional systems, the spiritual beliefs play a central role in health practices. They view illness as something that can affect both body and spirit together, meaning one cannot be healthy without the other being healthy. Although there are many traditional medicine systems, I will briefly describe a few predominant systems in the world. Chinese traditional medicine is based on belief in yin and yang, defined as opposing energies, such as earth and heaven, and happiness and sadness. These energies, flowing through the body's meridians, maintain a balance between yin and yang. When yin and yang are in balance, you feel relaxed and energized. If yin and yang are out of balance, it affects a person's health negatively. Acupuncture, herbal medicine, Tai Chi, Qigong are often used as methods of treatment in Chinese traditional medicine. Ayurveda is the predominant traditional medicine practiced in Sri Lanka. It originated in northern India over 3,000 years ago. It is codified and written down about 700 before Christ in two major treatises, namely Charaka Samhita, which deals with medicines, and Sushruta Samhita, which deals with surgery. In Ayurveda, every human being is born with a unique proportion of biological doshas, namely Vata, Pitta, and Kapha. Sometimes we call them wind, bile, and phlegm. It represents the genetic code of the person, which takes part in the formation of our physical and mental health characteristics. Health is achieved by balancing the three doshas. Many factors like psychic consciousness, thoughts, emotions, relationships, diet, your daily rhythm, the lifestyle, and our environment influence the balance or imbalance of these doshas. In terms of treatment modalities, Ayurveda uses herbal remedies predominantly, but dietary guidelines, yoga, meditation, and massage techniques are other types of interventions. Unani medicine, practiced by a few in Sri Lanka, is of Middle Eastern origin. It is based on balancing the four humors: blood, phlegm, yellow bile, and black bile. Again, herbal medicines, dietary modifications, and therapies like cupping and leeching are practiced predominantly in Unani medicine. Siddha medicine originated in southern India and is practiced in north and east of Sri Lanka. Siddha practitioners believe that 5 basic elements, earth, water, fire, air, and sky, are included in food and the humus of the human body. Herbal, animal, and inorganic chemical compounds are used in therapies for treating diseases. The African traditional medicine is viewed holistically and often involves community-based healing use of herbal medicines, spiritual rituals, and physical therapies are used often. They even celebrate an African traditional medicine day. Native American medicine believes that health is where human spirit and nature are in harmony. Illness is often seen as an imbalance in this harmony. Tobacco, cedar, sage, and sweetgrass are the 4 sacred medicines used in Native American medicine. Storytelling and drumming rituals too are used as healing methods. Sweat lodges are unique to American traditional medicine. Sweat lodges are heated dome-shaped structures used during certain purification rites and are used as a way to promote healthy living. Traditional medicine and allopathic medicine have different approaches, different philosophies, and different methods of treatment. These differences can complement each other if and when integrated effectively. Here are some main differences between traditional medicine and allopathic medicine. With regard to philosophical approach, traditional medicine is holistic and preventive. Modern medicine, it has a more reductionist and disease-focused manner they treated. Diagnosis is pattern of disharmony was objective testing. Approach to treatment is restoring balance, personalized treatment, and long-term treatment versus targeting specific diseases, standard protocols using evidence-based medicine, and rapid symptom relief. With regard to medications, complex herbal formula are used, and they are believed to have fewer side effects, and they produce or provide gradual relief in contrast to highly refined drugs, potential for side effects, and rapid relief in modern medicine. The focus of treatment in traditional medicine is strengthening natural healing, and you look at the whole body health. In contrast, in modern medicine, eradication of disease is the focus, and they are mostly organ or system specific. With regard to prevention and health maintenance, traditional medicine is prevention oriented, and it is long-term health management versus reactive care, screening for early detection in modern medicine. Regarding mind-body connection, in traditional medicine, there is integration of mind and body therapies for mental and emotional health. In contrast, in modern medicine, it's the biological focus where mind and body are treated separately with low integration. Patient-doctor relationship is close and long-term, and longer consultations with active participation of the patient, which is in contrast to focused short-term relationship, shorter consultations, and doctor-led treatment in modern medicine. In other words, traditional medicine is more holistic, preventive, and focuses on restoring balance, while allopathic medicine is more disease-focused, aiming to eliminate the root cause of illness through targeted interventions. Therefore, these two are complementary. Thus, integrating the strengths of both may result in a more comprehensive healthcare approach. What are the healthcare systems practiced in Sri Lanka with regard to traditional medicine? Ayurveda, Siddha, Unani, and Deshiya Chikitsa have been the main alternative medical systems in use. Deshiya Chikitsa is the Sri Lankan traditional medicine practiced through generations, or what we call Paramparika Vedakama. Ayurveda medicine is the most prominent traditional medical system practiced in Sri Lanka. Ayurveda medicine graduates complete a 6-year degree program inclusive of a 1-year internship, similar to Western medical practitioners. And similarly, Unani medicine is also taught in these 2 medical schools. 320 students graduate annually from both the University of Colombo and Gampaha Wickramarachchi University of Indigenous Medicine. Most go to India and a few to China and Japan for their postgraduate studies. Siddha medicine graduates are taught in the 2 faculties in the Eastern University and University of Jaffna, and about 250 students graduate annually from these 2 universities. Deshiya Chikitsa, the Sri Lankan traditional medicine, is learned by all graduates in the 4 universities alongside Ayurveda, Unani, or Siddha. Now I will present some data on the traditional medicine healthcare system structure currently operationalized in Sri Lanka under the Ministry of Health, which is directly supervised by the Department of Ayurveda. The traditional medicine health workforce with regard to doctors, there are 2,414 cadre positions, and among them, interestingly, there are community medical officers in traditional health, which is about 50% of the held by 50% of the cadre posts. I must acknowledge here the Department of Ayurveda who provided me, Dr. Sajivani Pereira, who provided me with this data for this oration. It is interesting to note that these community-based medical officers have almost a similar program of activities, but we see in the MOH in the allopathic medicine system. And they are distributed all over the island through the from the divisional secretariat levels. And there are 331 divisional secretariats, as you know, and they are all distributed to provide care in maternal and child health programs, nutrition programs, elderly and geriatric care, non-communicable diseases preventive programs, chronic diseases preventive program, chronic kidney disease preventive program, yoga, and attention to vulnerable groups. And their mandate is disease prevention and health promotion at community levels. These are the physical facilities under the Ministry of Health. As you can see, I wouldn't go into the details, but they have a structure similar to us. Rural hospitals, substantial number of Ayurveda hospitals, free dispensaries, central dispensaries are funded by the Ministry of Health. 64% of the hospitals among the Ayurveda hospitals are located in rural areas of the country. In addition, there are a large number of private hospitals and clinics offering traditional medicine services, numbering 164, as you can see in this slide. Look at the funding and allocation from the total health budget. It's less than 2% in most instances, the funding allocation. Although there is a structure, there's a wide discrepancy in the budget for allocation of services, for allocation of funding for services provided by this group. So moving on with that little information that I have given you from the services that are provided in this country on traditional medicine, I would like to move on to the next topic, the prevalence of the use of traditional medicine globally as well as in Sri Lanka. This is a recent randomized meta-analysis only using national studies of those countries. They are not cross-sectional studies, these are national studies published by these countries, and Lee et al. In 2022 published this. As you can see, the range of traditional medicine use amounts to ranging from 25% to 75% of the population of these countries using these services. And as you would notice, they are mostly from the Western countries. We don't have much data from the Asian continent. With regard to the prevalence of use of traditional medicine in Sri Lanka, there has been no national surveys, but a paper published by Pereira et al. In 2012 showed that 60% to 70% of the rural population use traditional medicine systems as their main source for primary health care. Next, I would explore the spectrum of diseases where traditional medicine is used often by patients. According to the WHO Traditional Medicine Strategy published in 2013, in the introduction, it showed that diabetes, chronic heart diseases, and hypertension, strokes, mental health disorders, chronic pain, women's health, and cancer support were the predominant areas where traditional medicine have been used, sometimes alone or in combination with allopathic medicine. And these are mostly non-communicable diseases, which is the main problem all over the world and also especially in Sri Lanka. If we take a few diseases, I just want to show you the prevalence of use of traditional medicine. It ranges from 12.4% to 77% in Africa, with a median prevalence of 50%. Traditional medicine was concurrently used with allopathic medicine by about 35% to 88.4%, with majority not disclosing traditional medicine use to conventional healthcare providers. Similarly, in Iran, a large number, 89%, use traditional medicine for type 2 diabetes. Strokes. The prevalence of traditional medicine usage in strokes was 38% in a systematic review, using 22 eligible studies taken from all over the world. With regard to the presidential address developed by Dr. Padma Gunaratne in 2011, she showed that 96% used some form of traditional medicine and predominantly Ayurveda, and some Desya Chikitsa and acupuncture after strokes, after development of strokes. In USA, which they carry these surveys every 5 years, the most traditional medicine approaches among stroke survivors were spiritual meditation, progressive relaxation, yoga, mindfulness meditation, mantra meditation, guided imagery, and Tai Chi. So there are lots of studies where stroke patients have been using traditional medicine. Similarly, in cardiovascular diseases, the systematic review of 27 studies showed the prevalence of traditional medicine in a wide range of patients, ranging from 4% to 64%. In sub-Saharan Africa, 38.6% use traditional medicine. And among these patients, 47.5% concomitantly used both allopathic medicine and traditional medicines together. With regard to mental health diseases, the prevalence was 30%. Among youth, most commonly, they used traditional medicine which were mind-body therapies, and more than that, the biological, that is herbal medicines, and common conditions were ADHD, depression, and anxiety. 62% of the healthcare units using conventional psychiatric care in Sweden use traditional medicine for anxiety, sleep disturbances, and depression. Reasons were symptom relief, meeting patients' request, reduced demand for pharmaceutical medications. These were government-run healthcare units. Similarly, 82% reported traditional medicine therapies within the past year to address mental illness in a Saudi Arabian hospital survey. Chronic pain is another situation where traditional medicine is used. 37% of US patients use traditional medicine for pain management. Yoga, meditation, chiropractic care, and acupuncture were the common methods. In Singapore, 84% used acupuncture for chronic pain. The American College of Rheumatology endorses acupuncture as an adjunct treatment for knee osteoarthritis pain based on studies showing modest pain reduction and improvement in joint function. And this is covered, it's an insurance covered system in US, and this medication is covered by their medical insurance. With regard to women's health, again with the US survey, 20% of pregnant women use traditional medicine for backache, neck pain, anxiety. Herbs and mind-body therapies were most common. 52.2% of subfertile women used herbal treatments, spiritual healing, and folklore methods for their subfertility. Similarly, 50% of menopausal women use traditional medicine in a systematic review. Finally, in support of cancer care, a large number of patients used traditional medicine in addition to biomedicine, that is modern medicine in cancer patients. The most common were Ayurveda and traditional religious practices. This was a study conducted in Sri Lanka by Broom et al. In a Swedish study, 34% patients reported traditional medicine use post-diagnosis cancer. So this has this an integrated approach of using traditional medicine with allopathic medicine been found to be beneficial. Several countries have successfully integrated traditional medicine with allopathic medicine to enhance patient outcomes. These integrated healthcare models, especially prominent in countries like China, India, Korea, Japan, and certain Western nations. And they have demonstrated the benefits of combining both systems for comprehensive care. The level of integration in clinical practice, of course, vary. Okay, I think I'm... So, with regard to integration, what are the models that have been practiced in these countries where they found these methods to be useful? There are several models of integration for integrating traditional and complementary medicines. They range from coexistence, like in Sri Lanka, to fully integrated care. With more research on the effectiveness of integrative therapies, these models are likely to become more prominent in global healthcare systems. So I will describe a few models that are in practice, the coexistence model or the parallel practice model. In this model, traditional medicine practitioners work alongside allopathic healthcare providers, but there is little formal communication or collaboration between these two systems, like in Sri Lanka. Patients often self-refer to both types of practitioners. Patients may not inform their allopathic providers about their use of traditional medicine. In Sri Lanka, as well as in some African countries for specific reasons, there is lack of communication between practitioners, and this may lead to potential risks such as drug-herb interactions or contradictory treatments. Another model is the collaboration model, where there is referrals and consultations. Collaboration is through referrals and consultations in both directions. And a good example is India. In Western countries like US and Australia too have established integrative healthcare centers that employ both allopathic doctors and complementary medicine practitioners in the same hospital. For instance, a cancer patient undergoing chemotherapy might be referred to an acupuncturist to manage treatment-related nausea, fatigue, or pain. The third model is integrated practice model, which is shared care. Here, traditional medicine is fully integrated into allopathic clinical care. Both work together within a shared care framework, often within the same healthcare unit, and there is active communication and coordination between the practitioners. In China, patients receive acupuncture, herbal medicine, qigong, or as part of their overall care plan for diseases like cancer, diabetes, and cardiovascular conditions. Some places in India has commenced this shared care plan. Germany have integrated naturopathy and homeopathy alongside allopathic care, demonstrating positive patient-reported outcomes in managing chronic pain and mental health in particular. The final model that is used in US is the patient-centered model. The patient's preferences, beliefs, and values guide the integration. The focus is on holistic care, addressing not only physical symptoms, but also psychological, emotional, and spiritual well-being. Mayo Clinic and the Cleveland Clinic in US adopt this approach, and research is inbuilt into the care program. This model requires healthcare providers to have a broad knowledge of both conventional and traditional medicine therapies. Studies show that this model helps patients with chronic pain, mental health disorders, and other conditions by addressing the biopsychosocial aspect of health. So there are several models as I have showed you. So next I would like to ask the question, what is the WHO stand on traditional medicine? This is what the WHO 2019 book, which I referred to earlier, also said. Traditional medicine is an important and often underestimated health resource with many applications, especially in the prevention and management of lifestyle-related chronic diseases, and in meeting the health needs of rural and aging populations in particular. The WHO more recently in August, in its publication in 2023, in August, states, I quote, WHO recognized the diversity of traditional medicine practices across countries of the world and its contribution to health, well-being, people-centered healthcare, and universal health coverage. An evidence-based approach is crucial even if traditional medicine are derived from long-standing practice and are natural. Establishing their efficacy and safety through rigorous clinical trials is critical. When I went to the WHO website, I found a lot of activity in the WHO website, where there are regional consultations, including even using artificial intelligence to kicking off the journey, and they have their strategies. And China and WHO deepen strategic partnerships to lead global traditional medicine advancements, and there's a second WHO Traditional Medicine Summit in November 2025, and work on implementation of the WHO Traditional Medicine Strategy. So much of work is going on in the WHO, and I just thought I will let you know about its stand. However, there are challenges to integration. And we need to identify these challenges if we are to move forward in integration. Integrating traditional medicine with allopathic medicine, although has the potential to provide more holistic care, there are challenges and obstacles. But however, I believe that most can be addressed to a reasonable degree if both parties work collectively and collaboratively. And I will spell out a few challenges. Lack of standardization, inconsistent dosages and preparations. Herbal medicines can vary significantly in composition and potency, even when they are based on the same plant. Differences in growing conditions, harvesting methods, storage, and processing can lead to varying degrees of efficacy and sometimes even safety. Therefore, standardization is particularly challenging for multi-component herbal formulas. Traditional medicines often contains multiple bioactive compounds that work synergistically, making it difficult to isolate and identify the specific components responsible for therapeutic effects. Regulatory bodies like the US FDA or European Medicines Agency prefer clear identification of active ingredients for clinical trials. Regulatory bodies often require also substantial preclinical data using toxicity studies or pharmacokinetic studies before approving human clinical trials. Many traditional medicines have been used on historic use and limited preclinical research, as we are all aware. Another issue is the regulatory pathway ambiguity or minimal regulations. The US FDA, for instance, requires clinical trials for botanical drugs, but has a separate category for dietary supplements, which do not need the same level of evidence. But as we all know, some plants are used as dietary components, and the same plants are sometimes used as medicinal products. So that's a challenge. In China, traditional herbal medicines are regulated differently from synthetic drugs, and many have been approved for use without the level of evidence required in Western countries. Another challenge is the lack of evidence-based research. The research is limited, often due to insufficient funding and methodological challenges. Without robust evidence, allopathic practitioners are reluctant to recommend traditional medicine alongside their conventional treatments. None of the ethics review committees in our 4 traditional medicine universities and the National Ayurvedic Research Center in Navinna are approved for Sri Lanka clinical trials registration. These organizations need to be supported in establishing their own ethics review committees through manpower development, by training and guidance. One may argue that these research proposals can be reviewed by faculties of medicine. These faculties of medicines are the committees are mainly dominated by allopathic practitioners who are not familiar with the philosophy and basis of traditional medicine, which is quite different to allopathic medicine, and therefore the outcome measures of these research proposals. The commissioned WHO report on traditional medicine research in Sri Lanka amply describes the paucity of traditional medicine research in Sri Lanka, and I have summarized a few points from this report. There is a lack of rigorous traditional medicine clinical trials in Sri Lanka. Most have been published only as conference proceedings, and few in peer-reviewed journals, and even few in high citation index journals. Many randomized clinical trials did not adequately report on key study components such as the sample selection and data collection methods, or either outcome measures or statistical analysis. Most studies were at the high risk of bias. The use of relevant Ayurvedic or traditional outcome measures was also absent in some clinical trials. This was a report by an Ayurvedic practitioner who was commissioned to do a review for the past 10 years and publish this report. Another issue is the intellectual property rights for traditional medicines is another problem, as many of these remedies are based on centuries-old knowledge. This discourages the pharmaceutical companies from investing in expensive clinical trials because they can't easily patent traditional formulations. Difficulty in measuring holistic benefits. Allopathic medicine relies on specific measurable endpoints. For example, changes in blood pressure or cholesterol or some index that can be measured objectively. This may not capture the full effects of traditional medicine. Traditional medicine often claims to promote general wellness and prevention of diseases, but these outcomes are difficult to measure in clinical trials unless they are double-blind placebo-controlled studies. Risk of drug-herb interactions. Some traditional herbs can interact negatively with conventional medications, altering their effectiveness. Lack of knowledge on interactions may pose a challenge during integration unless research has been carried out. Lack of cross-disciplinary collaboration. In many healthcare systems, including Sri Lanka, conventional practitioners and traditional practitioners work separately. This fragmentation makes it hard to coordinate care in this structurally dissociated system. The differences in treatment philosophy can lead to misunderstandings or conflicting treatment strategies. For example, Ayurveda emphasizes individualized treatment based on the body type or the doshas, while allopathy uses standard guidelines-based treatments. Patient expectations, patient autonomy might be different. Patients might expect quick symptom relief from allopathic medicine, but may look to traditional medicine for long-term wellness and prevention. Combining these approaches require careful alignment of treatment goals, which can be challenging without integrated care frameworks. Traditional medicine is deeply rooted in cultural practices, and integrating it with modern medicine requires sensitivity to indigenous knowledge systems. There is also an ethical obligation to respect and protect these traditions, which is often overlooked in integration efforts. While integrating traditional medicine with allopathic approaches hold much promise, careful navigation of these challenges is essential to ensure safety, efficacy, and cultural respect. Increased research, open communication, mutual respect, and cross-disciplinary collaboration are key steps forward to successful integration. So what is the way forward? According to the WHO strategic plan, there are certain recommendations for countries that hope to integrate traditional medicine with collaborative medicine, with allopathic medicine, Establishing a national expert committee on traditional medicine is one. Establishing a national program for traditional medicine, like for dengue or TB, a similar program. Upgrading the National Research Institute at BMARI. Conducting robust research on traditional medicine and conducting randomized control trials. Improving herbal medicine regulations to ensure efficacy and safety. National plan for integration of traditional medicine and modern medicine. After all these have been done. And also education on traditional medicine to allopathic stream of medical students and vice versa. US, Europe, Germany, South Korea are already doing this. For their have included traditional medicine in the allopathic medicine curricula. The chief guest, president, council members and past presidents of both associations, distinguished invitees, ladies and gentlemen. I believe through the evidence I have presented today that I have managed to sensitize to some degree at least this learned audience on the benefits of a formal allopathic and traditional medicine integrated approach in the delivery of care to patients, especially for chronic and non-communicable diseases which carries the highest morbidity and mortality in Sri Lanka. Countries with well-integrated healthcare systems that combine traditional and allopathic medicine has shown promising results in provision of holistic patient-centered care with enhanced patient outcomes, and they have been shown with evidence. Government support, committed leadership, collaboration between all stakeholders, interprofessional education and training on traditional medicine, regulation of traditional treatments, funding and other support required to upgrade traditional medicine research, to conduct proper clinical trials, and recognition of traditional medicine as a mainstream of treatment are some key measures to successful integration. By drawing on the strengths of both systems, we could make Sri Lanka a traditional medicine treatment hub for those living in Sri Lanka as well as for overseas visitors. Currently, the Ministry of Health is investing heavily on primary care, and this would be a good opportunity to initiate this process simultaneously. I hope that those who are convinced would carry this torch forward to make traditional and allopathic medicine collaboration a formal approach in the delivery of healthcare in this country, where traditional medicine is a deep-rooted practice among patients. This, of course, will need enduring, prolonged, collaborative dialogue among all stakeholders while focusing on patient outcome as their primary goal. I firmly believe that Sri Lanka Medical Association, being the premier professional medical association in this country, has a pivotal role to play in taking leadership to make this a reality. Thank you very much for your attention.
Thank you and congratulations, Professor Jennifer Pereira, on this wonderful oration. It was indeed scintillating and objective insight on allopathic and traditional medicine and how the gap can be bridged and how we can enhance the patient and outcomes. Congratulations once more. Ladies and gentlemen, we have now reached the end of the formal proceedings of this evening. We will now have a brief moment of respite, a moment to sit back and relax. For this, I would like to invite Dr. Kalana and his team. On vocals, we have Dr. Kalana, Dr. Harsha, Anjan, and Mathisha. On keyboard, Supun, rhythm guitar, Dr. Dhanuka, violin, Ravindu, bass guitar, Ashan, and on percussion, Pramukha. We would also like to extend our gratitude to Dr. Kalana for coordinating and managing this event. Let's put our hands together for Dr. Kalana and his team.
සසරේ හමුවේ යුගයෙන් බැඳි යුගයේ ලන්වී වෙත්වී වරින් වරේ ඔබ හමාරන් හුය කිනි බැඳුනේ. Where did I miss you, my love? Was it yesterday, today or tomorrow? Where did I leave you, my love? Was it yesterday, today or tomorrow? Iwagasema petumak petua senasum sayure susuman heluwa අතරින් පතරේ විය කීලා සටනින් අද මා දිනුවා. සමනලයෙන් ඉදිරෙනු දැක මට ඇගෙනෙන් පියලිය සිහි වෙනවා රන්සුර පුරකට නාකැදවන්නට රම්‍යා ගැන සිතුවිලි එනවා 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 එනවා
Ladies and gentlemen, I am sure you enjoyed that performance. So let us have another round of applause for that absolutely wonderful performance by Dr. Kalana and his team. And with that, ladies and gentlemen, we have reached the end of this evening's proceedings. We will commence the remainder of the foundation sessions tomorrow morning. And for now, it is good night. So please join us for refreshments, which will be served in the auditorium lobby, both upstairs and downstairs. So good night, have a pleasant evening, and please rise for the ceremonial procession. Once again, ladies and gentlemen, thank you for being with us, and please join us for refreshments served outside.